actually want to ask you to, as a follow-up to Lauren, to shed more light on the experience of being in treatment. I think Lauren was really interesting to hear you describe the process of, what are memories, how do we try to change our thinking, rewrite some of those memories or put them in different contexts. So this is work that you've been doing for
sort of broader than the memory piece, but for me, treatment has been both medication and psychotherapy. For a long time, people thought that people with schizophrenia couldn't benefit from therapy. There was a recent article in the New York Times that a lot of us benefit from the combination. And when I go 5 days a week with psychoanalytic psychotherapy, and when I try to figure out how it helps, I think of a bunch of different things. So first, stress is difficult for mental illness, as it is for all illnesses, and the analysis can help you identify and learn to cope with stresses. Second, it kind of fortifies or builds what we might call an observing ego that will step back, review what's going on in your mind, and help you understand it. It's a safe place to bring your scary and chaotic and violent thoughts, sort of like a steam valve. If you say them in therapy, you don't have to say them out in the real world and get yourself in trouble. It provides insight, and it's also a kind, smart, and well-meaning person who did I say this already? Okay. I really have a bad memory, to tell you the truth. Thank you. A kind and smart and well-meaning person who accepts you not only for the good, but the bad and the ugly. So all those things go together. And another way to think about this is that these days people talk about recovery. It's not just reduction and remission of symptoms, but quality of life. And it's for the person herself to say what that is for her. But certainly therapy can help with quality of life. Medication is something that I struggled with for a long time. I basically thought I wasn't really mentally ill, and if I could get off the medication, I could prove that. So I tried and tried and tried. And I think people resist meds for a number of reasons. First, they don't like the side effects. To me, if the question is, drooling at night or gaining 20 pounds, I'm going to take that over psychosis. Second, people feel better, so they don't think they need it, the way people stop antibiotics even though they shouldn't. Third, they're in denial. They don't think they're ill, although you can say, well, look, this helps with things you've been complaining about, like sleeplessness and so on anyway. What else? Fourth, and for me, this was the main one, was what we call the narcissistic injury of having a mental illness and needing care. It's just very painful to your self-esteem. But as I said, once I got on the medication continuously, my life got much better. At which point the illness, and paradoxically, the more I accepted it, was less kind of front and center in my life.
Can I ask him a third? How have you been affected by stigma? How personally have you been affected by stigma?
A number of different times. I mean, the first semester I taught mental health law, I had a psychiatric nurse in the class, and we were talking about a student who'd been withdrawn from medical school because she was a cutter. And the student was like, well, of course she should not be in medical school. I mean, I said, well, she hurts herself. She doesn't hurt other people. Well, laying on of hands. I said, well, what if you were a lawyer? And my student said, come on, would you go to a lawyer who was on psychotropic medication? And I thought, would you take a class with someone who's on psychotropic? I've also had experiences. A friend of mine at the law school, when my book came out, said she was glad she didn't know I had schizophrenia before we started going to dinner. And I said, why? And she said, I never would have gone to dinner with you, which was stunning.
How about when you got ill?
That's the dangerous side of stigma, right? I started having terrible headaches, and my friends came to find me because I wasn't answering my phone, and taken to the ER, had no short-term memory at all, and a predictable disaster occurred. They found my psychiatric records and decided I was having an episode. And my friends are jumping up and down, waving their arms, saying, we've seen her psychotic, she does not get like this. And they sent me home, and then my internist sent me back, and at the last minute, they told me to touch my toes to my hands, and I had pain, and they did a spinal tap, and I was having a subarachnoid hemorrhage, which kills like 50% of the people who get it, but I was just having an episode. And that's the dangerous side of stigma. And my friend Steve had a client who had terrible back pain and went from doctor to doctor, and all the doctors kept saying, it's psychosomatic, it's all in your mind, and someone finally did an x-ray, and he had a broken back. So that's,
And he was living with a mental disorder?
Exactly. But the other thing is there's internalized stigma. And I tell this story about, Glenn did this wonderful public service announcement with people walking around Grand Central with T-shirts that said schizophrenia, and loved one was someone with schizophrenia, bipolar, and she gave me a T-shirt that said schizophrenia. And my first thought was, well, I don't wear T-shirts to work during the week, but I do wear them on weekends. And then I thought, do I really want to wear a T-shirt that advertises I have schizophrenia? And then I thought, I've had cancer as well. People wear armbands and pins and T-shirts with pride and solidarity and without shame. And that's the way it should be with schizophrenia, but it's not. And I'm ashamed to say that I harbor some of those, negative thoughts, negative self-thoughts. And I agree with you. It's the biggest nut to crack because it deters people from getting care, and people shouldn't have to suffer, but they will if they don't get care. And it's so important. That's why what you're doing is so great.
And Glenn, I'm wondering if you can speak to the family member experience of, I think a lot of us have loved ones who have struggled with mental health issues, and what it's like to be on the outside of that, but really wanting to help and watching someone try to navigate the care system and really the world, how to build a life with quality.
Yeah, well, it's been a journey because, as you probably all know, a lot of the meds are very generic still, and I think one of the exciting aspects of the genetic revolution and as applied to mental illness is that there's hope that the medications or the therapies will get more and more and more specific and will be more effective. But so the journey has been both with my sister and with Kaylin how to deal with these meds, because some of them are really tough. And my sister, who was a beautiful woman, became obese to the point where just this past year she was told she was one step away from becoming diabetic. And she, because she's, unbelievably strong, she said, I'm going to prove that you don't have to be obese if you're on these meds, that it can be done. So she's lost 50 pounds. And that's really hard. She still has the belly. She's trying to get rid of the belly. But so I went through that. There you learn to be very vigilant about certain behaviors. And you learn that there's certain times of year, the changing of the seasons can be difficult. And I remember Jess called me. She's a writer, and she was saying, "Oh my God, I'm just having so much. I just was writing, and I feel so great." And it was so hard because I said, "Jess, are you going into a manic phase?" And she said, "Oh, I didn't think of that. I'll check with." She has this wonderful doctor back at McLean who she can check in with, and she said, "I'll call Dr. Vukovic," and called him, and sure enough, so they had to adjust her meds. And the next time I talked to her, she said, "Yeah, I had to adjust my meds, and I can't write right now, but and you but the thing that's really cool is that once that kicked in, they're starting to know, even with the kind of generic quality, that you can adjust it so you can be productive. She's starting on another book as of this past month, and it's wonderful. But there was a time where she called up, and she was it was before she was diagnosed, and she wanted to take a shower, and she was terrified. She thought something was in the shower. And so I was on the phone, and I said, "Get the dogs. Are the dogs with you? Get the dogs in the bathroom. Okay, now put down the phone, and they're there, okay, step in, and I'm here, go ahead." And it's things like that. That hopefully we're beyond that. But I think about this, and I was talking to Ellen about it. Those of us who hopefully will be able to talk openly about mental illness and how it affects all of us. It's a family affair, I say. We have to educate ourselves, and then we have to have a grassroots movement where everyone is starting to educate themselves as to what these different illnesses are, and what we have to understand and have hopefully enlightened leadership to help us is, when do you intervene? You know, and that's a very delicate question, because the laws now are more for not committing somebody, right? It's very, very difficult. My best friend committed herself to a psychiatric hospital 2 weeks ago for serious depression. And I'm very proud of her for doing that. And she's getting better. She's getting the ECT. But that to me is a very tricky, and then also another tricky thing that probably some of you have probably encountered, and it's always the hardest question that comes up, is if you know somebody needs help and they're in denial, what do you do? What do you do?
Speaking about family and friends, there was a time where my closest friend is a guy named Steve, who's a lawyer and a psychologist. And every once in a while, I'll get so ill that he thinks he should call my doctor. For some reason, I knew my doctor was going to China, and he called my doctor and said, Dr. Kaplan, I'm very worried about Ellen. She's really psychotic. She's talking about going to China in advance of your trip and clearing it out of all the bad people. And he said, oh, how very considerate. But it really helps to have friends and family around. I mean, Jesse and Kim are lucky.
Right. Do you mind if I add? Yeah. So I just wanted to add a couple. I mean, I think one of the amazing things about the stories of success is also the unbelievable willpower, right, that is required with the current situation, the talent and so on to work with drugs that are really often not great and treatments that sort of work. And with enough willpower, amazing things are possible, right? And so that's just another element of this. And then I also just wanted to briefly add, I think it can be useful to understand why the drugs are not that great. And like the case of bipolar is a really wonderful one because there may be a simple reason. So just many of you may have heard about SSRIs, selective serotonin reuptake inhibitors. So this is a common drug that's particularly used often for bipolar disorder. And the idea originally was that, well, somehow you have not enough serotonin. And so if you get more of it out there with these SSRIs, that's sort of what they do, that helps renormalize the brain. So there's a lot of issues around that interpretation. It turns out that's probably wrong, but the important thing for this is it turns out serotonin is used all over the gut. So our stomachs use serotonin for all sorts of signaling. And so there are these incredibly complicated relationships. The chemicals that we use are used throughout our bodies in 50 different ways. And the drugs we have are hitting them with a sledgehammer. Right? And so this is the hope that Glenn was talking about, that if we have a better genetic understanding or a better understanding of what makes everyone different, then you can start tailoring things to that particular individual. And I think there's tremendous hope there once we get there.
Another thing of our message is, if you have mental illness in your family, avail yourself at a good research center and give them your DNA. The more, I mean, Tom, you can attest to this, the more data there is, the faster we'll get to these different therapies and cures. But Jesse and Kaylin have a rare mutation that is in a gene that affects psychotic behavior, and they've been part of a huge study. The two of them, they have a pill. They got to choose the color of their pill.
That's hilarious.
They have a mouse, but that's a rigorous. Another reason why I have such huge respect for all of them, because it's a rigorous thing. But think about that, because I think it would make a huge difference if you think of all of us involved if we added to the database.
And so staying on that topic of hope and bright spots, I just want all of us to think about what are the things that you see in the world through your work with social change and advocacy and legal policy change that are the most exciting places for people like all of you in the room to get involved and make an impact? Well,
I'll start with Bernice and Indiana University. I was invited to go out there, and I visited Pamela, our executive director was there as well. She had organized a class and asked, they were all different teams of freshmen, and asked them to come up with campaigns around stigma and mental illness. And we went from station to station, and I was blown away. It was peer-to-peer. These kids came up with fantastic ideas. And we had the idea then to use Indiana University as our laboratory to establish what we're called the college toolkit, to have a data-based toolkit at the end of, what is it going to be, 2 or 4 years, where these campaigns, all these peer-to-peer initiatives that the kids are doing, can they say this worked, this didn't work, this did work, this is the paperwork you need, this is what you need to have in your campus. I think if every campus could become a safe and stigma-free zone, teach your kids on those 4 years that they're there what that means, then they go out into the world as ambassadors. It's hugely ambitious. We have over 2,000 kids in part of the survey. But I believe in data-based goodwill, not just goodwill for goodwill's sake, because you want to know that you're actually moving the needle, as they say. So that's one thing very exciting. And the kids are phenomenal. I mean, they are so willing, because a lot of them have friends who either have a mental illness, or across the campus, there's knowledge of kids who have committed suicide. There's so much of that on campuses now. We have another pilot program. I'm not pitching anything, but I think that in high schools as well, I think they're much more open to talking about it than maybe our generation.
They
has
also
been.
speak the same language.
Yeah, they know where they're all talking when they get there.
Yeah.
It's very exciting.
I underscore that with the students I speak to. Should I mention this in my application to law school or whatever, and we talk about the pros and cons, and a lot of them are like, well, it may be risky to do it, but this is who I am, it's part of me, I'm not ashamed, I'm going to say it like it is, and that's really pretty amazing. One of the things that I've seen happen in the past few years that I find very encouraging, well, mechanical restraints, which I think are really traumatic and really toxic, there's efforts to reduce them in certain places, which I think is good. And then there's also been efforts in LA, in part because of our program on criminalization, to stop people putting mentally ill people in prisons and jails, to have criminal law diversion programs where you go to a mental health court and you get, quote, sentenced to treatment instead of jail or prison. And I think that's an enormously promising approach to helping people and to avoiding the terrible horror of a mentally ill person being in jail. I mean, actually, a former student of mine, it turned out she was Marlon Brando's daughter, but she did a video documentary, and one of the homeless people was saying, I'm put in jail and they say stand online, and then my voices tell me go over there, so I go over there and I get beaten up and I have an infraction marked against me. And it's well known that people with the same kind of convictions and sentences spend much longer in jail and prison if they have a mental illness than if they don't. So I think those are two important things.
I think we all realize, well, I've learned that how do I say it? That mental illness is the least funded problem in this country. And I know that has something to do with stigma.
Yeah.
And I think what we need to demand is government-funded, and there's now a pilot project with the Excellence in Mental Health Care Act in 8 states, where the government will fund community-based centers for people to get help. And they could only pass that as a pilot project for 8 states. But that's what we should demand, programs like that need to be funded, because you could say, go to get help.
Right.
Where do you go?
Help, yeah.
And I think that, just to chime in on that, I think it applies in academic settings as well. So speaking of college campuses, there are named buildings on campuses for engineering and for biological sciences, but who wants to put their name on a psychiatry building or a psychology building? And so I think that needs to change as well. That if you look at most college campuses, that's never a named building, which I think reflects exactly what you're saying.
And I think, on the basic science side, it's this very mixed bag. On one hand, there has been an unbelievable revolution in the last 20 or so years in our understanding of the brain, particularly our understanding of mice and rats' brains, though, which is, right, not where we actually all need to be. But we're getting there. But at the same time, funding from the government, which is where most of it comes from, there was a doubling in the Clinton era. And since then, the actual funding level has dropped. So it hasn't kept up with inflation. Right now, when scientists apply for grants to do mental health research, the funding level is about 12th percentile, which means only 1 out of every 8 gets any money at all. And that makes it really hard. Each of these grants takes about a month to write, and you can do the math. How much time do scientists spend trying to get money as opposed to actually being able to do things? And how conservative do they need to be rather, to actually get these things through the councils as opposed to being able to try new things? So I think there's both incredible need on the front lines, but also need as a society, from my perspective, to really invest in the things that 50 years from now could change everything.
It's incredibly short-sighted not to fund mental health. Tom, do you have the statistics about how many work hours are lost on average by people who are absent because of mental health problems?
When we talk about not only absenteeism but presenteeism,
Mm-hmm.
it's an equal problem, maybe greater problem, that people who push themselves to go to work because they have to get a salary, and still can't function because they're not getting treatment. What makes this particularly difficult is that almost all these disorders are entirely treatable,
Mm-hmm.
and yet it doesn't happen.
Yeah. Do you want to speak about anything regarding access? Because I think that's what Tom is mentioning in terms of, you've both spoken about how privileged you were to have your family members and yourself be able to access effective treatment.
I have people in an audience say, you have therapy 5 days a week. I can afford to see my patients every 3 months for 15 minutes. How on earth are they supposed to do as well as you? And I say, you're totally right. And I have some survivor guilt. I've just been very lucky in that way, but it's a terrible problem. It's not clear to me, though, that providing good treatment wouldn't end up being cost effective and keeping people out of hospitals and keeping them at work and those kinds of things.
It's really a national crisis.
Yeah.
There's no place if a child is. I've heard this in Massachusetts for some reason. I guess it's because of McLean. If a child has some sort of disorder and the family is totally disrupted, and that child is taken to an emergency room, you can only stay in an emergency room so long, and then there is no place for them to go. There's just so many beds, So it's a terrible problem, and families suffer, and the dysfunction that creates really affects every single member of the family, certainly the siblings of whoever it is, and so to me it's shameful. It's shameful that we have not demanded better funding and better care. And it's also stupid.